Okay, so for our final discussion on blood, we are going to be talking about how the body stops blood loss from happening. So this process is known as hemostasis, which is the stoppage of bleeding. One of the things that we talk about a ton in anatomy and physiology is the idea of homeostasis. Just always kind of point out hemostasis is involved in maintaining homeostasis, but they are not the same word, mean two different things. So just gotta always watch out for that extra E that you would see in there, the extra O, excuse me, in the homeostasis versus hemostasis. What we're gonna see is this event is really a three-step process that is involved in really preventing blood loss. One of the cells that is going to be involved in this is what's known as a platelet. Technically, a platelet isn't a cell, it's actually a cytoplasmic fragment of a very large cell known as a megakaryocyte, which is found in the red bone marrow. And as you can kind of see around this large cell here, you have these small little platelets, which are fragments of this large cell breaking off again. Not going to have a nucleus and have very little in the way of organelles. And usually per microliter, the microliter of blood that we're talking about, you're looking at anywhere from about 150 or 100,000 to about 400,000 platelets per microliter. With hemostasis, what's really going to happen is you're going to have some injury to the blood vessel, as you can see at the top here. You're going to start losing blood. One of the first things that happens is we're going to get what's known as a vascular spasm. What this is the muscle, the smooth muscle cells that are in the blood vessel are going to contract down and lead to a vasoconstriction, and what this is going to do is actually limit the amount of blood that is flowing through that particular area. What we see happening next is a platelet plug forms, so kind of like someone taking a little bit of gum and sticking in a little hole there, something that's going to be trying to temporarily seal this until we can get a little bit more complete sealing of this. And the final step of this is what's known as coagulation, and this is a cascade of events that leads to those soluble fibers that we were talking about in the blood before. It leads to these actually coming out of solution and sealing up the spaces left around the platelets. So the vascular spasm, again, is going to be the smooth muscle in that arterial wall squeezing down. What then happens is we get the platelets start sticking. Normally platelets do not stick to the linings of the blood vessels. Those endothelial cells usually inhibit platelets from sticking to them, but when you get a break in the blood vessel, some of that connective fibers that would normally not be exposed are exposed, and it's really this exposed collagen that is exposed, and when platelets bond to this, they're going to start some signals that are going to really lead to more platelets, and other things happen here that are going to trigger this blood clotting process. And what they release a couple of different types of chemicals, this ADP as well as this thromboxane A2. Neither of these are things that I would say are going to be important to memorize, at least in terms of the overall idea here, but these are both released. They're going to lead to vasoconstriction. That ADP also makes other platelets more sticky, so what happens is these new platelets start sticking to the platelets that are already there, and basically you have a positive feedback loop happening where these sticky platelets are causing more platelets to stick and more platelets to stick until we form this large plug that is going to try to seal the hole. The other thing that happens is, and it can happen as a result of these platelets sticking to the collagen as well as a result of tissues damaged around this opening here, but it can lead to that blood clotting cascade being triggered, and we're going to see this is that coagulation of the blood, so those fibers coming out of solution. It can be triggered in a couple of different ways. They talk about the intrinsic versus the extrinsic pathway. Intrinsic means everything is, for this clotting pathway, is found within the blood. So the intrinsic pathway is going to be started by the platelets. The extrinsic pathway, which we're going to talk about first, what happens on this one is you have cells that are close to this blood vessel, so this perivascular cells here, they release something called tissue thromboplastin, and what's going to happen is this is going to activate some other pretty much other factors in this clotting cascade, and you're going to get this cascade of things where these things here activate what's next, which activate what's next, all the way down until we actually get these fibers coming out of solution. In the intrinsic pathway, it's actually the platelets, when they come in contact with these collagen fibers, releasing a particular factor, which again is going to activate other factors down the line and again get these things coming out of solution. When they get down to the bottom, so you can see extrinsic pathway caused by the tissues around here, intrinsic pathway by the platelets. But what you can see is when they get down to the bottom here, you have this pretty much chemical called prothrombinase. It gets activated into prothrombin, which then gets converted into thrombin. Thrombin is going to be the enzyme that is going to activate that fibrinogen, which is a soluble form of fibers in the blood. It's going to convert that to fibrin, which is going to have these fibers coming out of solution, and these fibers are then going to start laying over those platelet plugs and sealing the gaps within the blood vessels. So to me, the role of fibrin is a lot like the picture I'm kind of showing you at the bottom here. I know it's a disgusting picture, but it drives home the idea here of how fibers can actually seal up this hole. Any of you have ever, your wife or yourself possibly with long hair, you take enough showers with that drain, if you don't have some way of sealing that drain hole and not letting the hair get in there, over time what happens is you get enough small hair fibers and they lay this way, and really the way fibrin works is it lays over the openings in this blood vessel just like hairs get to do in a drain, and sooner or later that's going to stop or completely slow down the flow of blood going through it. Then as you can kind of see here, the platelet plug does contract a little bit and make a more compact plug and seal off that hole. When you get zoomed in on it, this is basically what you end up seeing when you get to that whole sealed blood vessel at this point. So you can kind of see you have red blood cells in here trapped. You have the platelets kind of sticking together, and all these things that almost look like a spider web or cobwebs all over this. These are actually all these fibrin threads that have went all over this whole thing and sealed those holes. Over time, what happens is the body is then going to remodel those connective tissues and stuff like that, repair the epithelial cells, and fix that hole and really replace that, dissolve the clot when everything is said and done. You can have some problems with this if you've ever heard of hemophilia. This is an absence of a particular factor. It is a sex-linked trait, much more common in males. Honestly, the European monarchy, especially the Russian czars and their children, because basically cousins married cousins over there and had kids. We saw a lot of this in the European monarchies back in the day where hemophilia was quite common. Again, it's an absence of particular factors here that are really not letting the blood clot at all. And again, it was very dangerous to anybody who has this because a small cut could be enough to kill you because you could not stop yourself from bleeding. There is also other things that you need to worry about with coagulation, and this is more of abnormal coagulation. So normally it's only a break in the blood vessel should trigger this clotting process. Every once in a while, and I'm sure you've heard of this before, you can have abnormal clotting. So one of the things they kind of tell you to stand up and walk around on a plane is to prevent deep vein thrombosis. So a thrombosis is an abnormal clotting of blood in a vessel that's not broken. A lot of times this is if blood sits for too long, it will begin a clotting process. The next thing that can happen is if this thrombosis is just in one spot, stuck to the wall, we call it a thrombus. If it detaches and starts moving around, we call it an embolus. It is then traveling through the bloodstream. A lot of times at some point or another, this embolus is going to get to a blood vessel that is too small for it. It's going to get stuck and get lodged in there. At that point, we call it an embolism. These are quite dangerous because they're going to block the flow of blood past that embolism and lead to a lot of times death of the cells downstream, and that's what we refer to as an infarction. So myocardial infarction is one of the names for one particular type of heart attack where you have a clot that breaks loose, clogs a blood vessel in the heart, and you have death of heart muscle cells downstream of that. That is that myocardial infarction.